I will present the results of a qualitative study on the perspectives and decision-making process of Muslims with diabetes on Ramadan fasting. So in some people with diabetes, Ramadan fasting is associated with an increased risk of acute complications. The main complications are hypo and hyperglycemia. From a religious perspective, certain individuals are exempt from fasting, such as people with an illness. Nevertheless, the majority of Muslims with diabetes choose to participate in Ramadan fasting. Studies have also shown that many Muslims with diabetes choose to fast against medical advice, potentially increasing their risk of complications. So in our study, we explored how Muslims with diabetes decide whether to fast during Ramadan. More knowledge on patients' perspective could provide relevant insights into patient-centered care when healthcare professionals discuss Ramadan fasting with their Muslim patients. So therefore, we conducted a qualitative study consisting of 15 focus groups. Participants attended a pre-Ramadan educational session at their local mosque, primary healthcare or community center, and were asked whether they wanted to participate in the study, and those who gave informed consent participated in one of the focus groups. And all focus groups were conducted in participants' native language, were audio recorded and transcribed verbatim in Dutch. And we performed the analysis according to Brown and Clark's 6 phases of reflective thematic analysis. So here we see an overview of the characteristics of our participants. We included a total of 73 people with diabetes. The majority were female of Moroccan descent and have type 2 diabetes. The mean age is 60 years with a mean diabetes duration of 30 years. And almost half of our participants mentioned using only oral medication, and 1/3 a combination with insulin, and approximately 72% fasted during Ramadan. So in this figure, we see the 3 main stages we classified in the decision-making process for eventually refraining from fasting. In the first stage, shown in green, are participants who have positive experiences with fasting and chose to fast. And participants in the second stage disclosed enduring physical challenges during fasting, such as symptoms of a potential hypoglycemia, but nevertheless, most continue their fast as they wanted to try to fast for as long as possible. And in the third stage, individuals decided to refrain from fasting after having reached their physical limits. And participants also indicated that this decision-making process for eventually refraining from fasting could take time and is often a dynamic process. So patients may attempt to start fasting again before deciding to refrain from fasting permanently. And within this decision-making process, we identified these 4 teams, and I will discuss and illustrate each team with a few quotations of the participants. So for the first team, participants mentioned different values and beliefs which were important in the decision on whether to fast. And as demonstrated in this quotation of a 59-year-old Moroccan woman, some participants were keen on fasting as they wanted to fulfill their religious obligation. And this participant eventually refrained from fasting after she experienced not being able to fast anymore. She considered that the will of Allah. So participants who had positive experiences with fasting reported that fasting had a positive effect on their physical health and on their mental well-being. And a few participants also expressed their wish for Ramadan fasting throughout the year. They felt good during fasting, and it allowed them to structure their diet habits and prevent overeating, as expressed by this 62-year-old Moroccan man. But not all participants had positive experiences with fasting. Some mentioned feeling tired or suffering from a hypo or hypoglycemia. And some even continued fasting despite developing symptoms, as demonstrated in this quotation. And this participant chose to lay down when she experienced symptoms of a possible hypoglycemia in order to continue her fast. But we saw also that participants who refrained from fasting also mentioned enduring challenges during fasting due to changes in their diet and physical activity. For example, some participants reported eating less during the daytime because their family was fasting, and therefore they experienced hypoglycemia. As to perception of illness, most participants did not feel their condition was severe enough to refrain from fasting. They mentioned feeling healthy or using only oral medication. The absence of comorbidities such as kidney disease were viewed as conditions under which fasting was possible. As for the last theme, most participants who were advised by their healthcare professionals not to fast reported choosing to fast against medical advice. They implied that they were their own doctor and they relied on their own judgment on whether they could fast. So in conclusion, we found that Muslims with diabetes experienced a high degree of autonomy in their decisions on whether to fast. This personal decision is based on participants' beliefs, value, perception of illness, and mainly on their previous experiences with fasting. The decision to refrain from fasting is often a difficult one and mostly made after individuals have reached their physical limits. We also have indications that some patients lack knowledge and skills to manage their diabetes during Ramadan. As to recommendations for clinical practice, our study advocates shared decision-making when counseling Muslim patients with diabetes on Ramadan fasting. It's also important to discuss previous experiences patients had with Ramadan fasting. And it's also crucial to educate both fasting as well as non-fasting Muslims with diabetes on self-management during Ramadan to reduce the risk of complications. Thank you for your attention.